I am Dr. Goyal speaking from Sanjeevan for Perfect Eyesight, Bombay. Today's topic is how to check for genetic defects in children. When child is in mother's womb, at that time, mother's blood and saliva can give us lot of studies about chromosomes or genetic structure of the child. Other tests are very important tests are there. Prenatal means when the child is not born inside the womb only, like ultrasound and sample from the placenta is called as villi sampling, and fetal echocardiogram and amniocentesis. There are a lot of tests which can give a clue about the chromosomal and genetic study. As I was saying for ultrasound, when we do ultrasound at the time when mother is pregnant, that give a lot of information about the structure of the child. If any deformities are there, we can doubt about the genetic changes or genetic defects are there in the child. There's a lot of fluid around the child, give us a lot of clues about the syndromes like Down syndromes and all. If we feel, if we sense, if we doubt a heart anomaly, then we can do fetal echocardiography or fetal echocardiogram. That give us a structure of the heart of the child. So if any defect in the heart, we come to know. The important test is CVS, chorionic villus sample. In that case, we take a small tiny piece of placenta. Placenta is a part which connects mother to the child. We take a tiny piece of placenta and look for chromosomal or genetic defects. That's a very, very important test which we do to know the genetic defects in the children. Amniocentesis. In amniocentesis, we collect fluid around the child from the uterus of the mother. Lot of fluid is there around the child when the child is in the womb, that we see that amniotic fluid analysis for knowing the genetic changes, chromosomal or genetic studies. Generally, we test for proteins produced by the baby. They are the tests which can give us a clue of lot of things if the genetic problems are there, like Down syndrome, sickle cell anemia, Tay-Sachs disease, X-linked chromosome problems, retinitis pigmentosa, retinine deficiency, so many things. So many diseases are there which are related to genes. Sometimes there are defects coming from the families from generation to generation, or sometimes mutation of the genes are also there. So by doing all these tests can give us a clue that child is suffering with genetic problems or not, or sometimes they are suffering, sometimes they are carrier. Every structure, every details we can find out from these tests. After the child take birth, we can also find out some genetic defect by medical examination and by genetics. So this is a very important issue. We'll talk this much in this video about the genetic detection or detection of the genetic defects in the children. See you in the next video for other topics. If you want to contact us, you can contact on 9324240702. You can visit our site www.sanjeevan.in, or you can contact us on or mail us on info@sanjeevan.in.